Okay, hi, I'm Pia. I'm a pharmacy intern here, and your name is?
My name's Alex Jones.
Okay, nice to meet you today. The purpose of our consultation is to share some information about the new medications, all right? And if you have any questions, just feel free to stop me, all right? So, before I start, what did the doctor tell you about this medications?
Nothing really. I just had some problems with my acne. So
Okay, that's fine. So the doctor has prescribed two prescriptions for you today. One is doxycycline and one is a NovaRing. He prescribed NovaRing is to insert one ring vaginally for 3 weeks, and then at the beginning of the fourth week you should take it out.
Okay.
All right, and you'll have one refill. And then for doxycycline, he prescribed 100 milligram tablets, and you should take one by mouth twice daily. And you have 60 quantity, and you have two refills. All right. So I'm going to tell you more about the medications. So I will start with NovaRing. Okay. So NovaRing basically is a contraceptive. It's basically to prevent pregnancy. All right, so how to use it? You want to wash your hands, and then you want to open up the package. All right, and then you want to use your thumb and your forefinger, and then to hold the ring, and then you want to raise up one leg against one leg on the ground and the other leg maybe like a toilet, and find a comfortable position, and then insert the ring as far as you can, so that you should not feel anything. But if you feel something, that means it has not gone deep enough.
Okay.
All right, and then you should insert the ring on the first day of your mens. If you do that, you do not need any sexual barrier. When I mention sexual barrier, you can use with the exception of diaphragm, because you already have the NovaRing inside, and then with the diaphragm in addition, it will not be effective. All right, and when you start on the first day of your period, it should be effective immediately. All right, and then if you insert on the second to the fifth day of your mens, you should have a barrier for 7 days. That's because it takes about a week for the NovaRing to kick in, to be effective. All right, and then for some of the severe side effects will be blood clot. All right, so for example, you might have some maybe breast cancer. There might be a risk of breast cancer, so you want to do a breast examination every year.
Okay.
And then there can be some swelling on your feet, so just monitor for that one. And then so one of the common side effects will be weight gain, and I could see from your medical history or your social history that you eat fried food 4 to 5 times a week. So I will encourage you to increase fruit and vegetables, and then also have to have a healthier diet, and then exercise. That will help you to reduce your weight gain as well, if that should arise. And then as for drug interaction, I look at all your prescription. There are no drug interaction. That should be fine. As far as a missed dose, you want to if it's less than 3 hours and the ring came off. Oh, sorry, there's some.
I'll just have to bring the bench over there. It's gonna work. Sorry about that.
just keep going. That's fine. Yeah, it's okay. Just keep going.
Just keep going. Okay, so if the ring came off less than 3 hours, you want to rinse it with cool water, and then you want to reinsert again. All right. So if that's less than 3 hours, for the first 2 weeks, and then you should have the barrier for. Okay, let me restart. If the ring came off less than 3 hours, just rinse it and then reinsert it. If the ring came off for more than 3 hours and it's in the between your first to second week, you need a barrier for at least 7 days. But if the ring came off more than 3 hours at the third week, then you will start a new schedule again as before. Okay, so it's important that you find a day to insert a ring, because the day that you insert should be also the day that you take it off as well. Okay, so that should be the beginning of the fourth week that you should take it off. So let's say you have Monday on and then Monday off to take it off. All right. Okay, so as far as for the storage, you should store up up to 4 months in room temperature. If it's in the package, you can just store it until it expires. All right, and then you should keep the original foil package, because when you dispose it, you should dispose together with the package too. All right, so that is for the NovaRing. Let me continue with the doxycycline. Doxycycline is an antibiotic, which I believe is to help with your acne. That's why you are taking one tablet twice a day by mouth. So in the morning and then one in the evening. All right. So one of the common side effects will be like more sensitive to the sun, so that's why you need to put on sunscreen. And then one of the common side effects as well will be the throat irritations. That's why you should take it and then flush down with a lot of water, be in upright position for at least 30 minutes. So don't lie down after you take the medication. That will help you to prevent throat irritations. So as far as drug interaction go, you want to separate it out at least 2 to 4 hours from your multivitamins as well as milk. All right, and then one of the most serious reaction will be like allergic reactions, maybe like rashes. One of the more serious one will be the anaphylactic shock, which is might be cause shortness of breath. In that case, if that happens, you just want to seek medical help by going to the ER. Okay, as far as missed dose for the doxycycline, take it as soon as you remember. Okay, if it's close to your schedule, so you can just take it by then. So my point is, don't double up your doses. All right. And then as far as storage wise, you want to store away from light and also from children. Okay, I know I've gone through a lot of information with you. Do you have any questions for me?
I don't think so. You did really good.
Okay, thank you. So just for me to just to summarize, just to make sure that I get everything clear. So how long should you leave the Nova ring inside the vagina?
3 weeks.
3 weeks, and then when should you take it off?
Leave it out for 1 week.
Okay. Yeah, so you live in 3 weeks, that's correct, but at the beginning of the 4th week, you want to take it off. Okay, yeah, no worries. As far as for antibiotics, doxycycline, I would like to also note that you should complete the course as well. All right, so how should you take your doxycycline?
You said 1 tablet by mouth twice daily?
Yeah,
Okay.
so and then also in the upright position.
Yes. For
Yeah,
30 minutes.
for 30 minutes at least. Yeah, so that's to prevent your throat irritations. Okay, thank you so much for your time. And then if you have any questions, here's my contact information. If you have any questions, feel free to call me. Okay.
Okay.
All right.
Thank
Thank
you.
you.